My name is Sue Verdegem. I'm the CEO for United Zion Retirement Community.
I am Ellen Haupt. I serve as the Administrator for Skilled Care at United Zion Retirement Community. We would like to provide you with an update on the impact of COVID-19 on our skilled care facility.
In early March of this year, United Zion put into place our pandemic response plan. This plan followed all guidelines from the Pennsylvania Health Department and the Center for Disease Control and Prevention. The plan, among other things, included eliminating visitors except in extreme cases, stopping group activities and group dining, and screening all team members and vendors when they enter and leave the campus. We were also screening residents each shift for COVID-19 symptoms.
Over the past 2 months, our team members were vigilant in protecting the residents. If they were ill for any reason, they would talk with primary care providers to see if they would recommend COVID testing. We welcomed the testing as we saw it keeping to the residents of United Zion safe. Team members generally felt better before the test results came back negative.
During this time, we were also monitoring the precautions and guidelines of CDC and the Department of Health and adjusting our pandemic response as guidelines suggested to seek to keep COVID from the residents of United Zion. Mid-April, in a very short period of time, our lives changed when 3 staff persons tested positive. The first staff person had little resident contact. The other 2 team members worked closely with residents in skilled care. We immediately intensified the observation for the residents those team members had contact with.
Saturday, April 25th, we received notification of 2 residents who tested positive for COVID-19. Immediately, we increased the infection control precautions for these residents, the residents who had rooms near them, and the residents who we felt may be showing symptoms.
We are pleased to now have consultation available to us from ECRI, the State Health Department Infection Control Consultant. They have validated the approaches we have taken and are taking to manage the outbreak. We are also receiving PPE, personal protective equipment, from the Department of Health.
We are working with our medical director daily to determine the best treatment available for our residents with the virus. What are we learning?
We are learning what the national media is telling us is true. The virus is highly contagious. It is generally mild for younger people, such as our team members, but can be more difficult for seniors. It affects each person differently. We see people with a first symptom of loss of taste or smell, some with a cough, some with a mild fever. Each person is different. The recovery is different for each person. Some are very sick, some are not, and appear to pass through the virus quickly.
We are also learning what an amazing nursing team we have. Today is National Nurses Days. We have all seen in the past 2 months how great our nurses are. Today, we honor them. We are also expressing our sincere appreciation to every team member, from dining, housekeeping, life enrichment, maintenance, to the receptionists. All work tirelessly to keep residents comfortable. We know we work with superheroes.
Ellen, in addition to being our licensed nursing home administrator, you're also a registered nurse. Happy Nurses Day to you. Thank you for what you are doing. We also appreciate the residents of United Zion and their families who are supportive of the work the team is doing. We appreciate the community who is supporting us through words of encouragement and gifts. We are deeply touched by the outpouring of support.
We recognize Mother's Day is this weekend. We understand how hard this Mother's Day is with the inability to visit. If you would like to arrange a FaceTime meeting with your mother, please reach out to Zach Souders in Life Enrichment. You may also drop off gifts, flowers, etc. at our screening location at the main entrance for us to deliver to your family members. Please drop off gifts a few days prior to when you want them delivered so that we can organize and sanitize them.
We want to conclude by again expressing our thanks to residents, families, and the community during these difficult times.